Dopamine is a neurotransmitter and hormone that mimics the effects of its naturally occurring counterpart in the body. It plays a crucial role in the body's sympathetic nervous system or fight-or-flight response, making it a sympathomimetic. Dopamine binds to dopamine, alpha-1 and beta-1 receptors with dose-dependent specificity. At low doses, less than 3 micrograms per kilogram per minute, it activates dopamine receptors only. At moderate doses, between 2 to 10 micrograms per kilogram per minute, it activates dopamine and beta-1 receptors. And at high doses, greater than 10 micrograms per kilogram per minute, it activates dopamine, beta-1, and alpha-1 receptors. Peripheral dopamine receptors are found in renal blood vessels. When dopamine binds to these receptors, it causes vasodilation of renal blood vessels. This increases glomerular filtration rate, or GFR, and therefore urine output. Beta-1 receptors are mainly found in the heart. When dopamine binds to these receptors, it leads to a positive inotropic and chronotropic effect, meaning the heart's force of contraction and rate increase. This causes an increase in cardiac output, and therefore blood pressure. And alpha-1 receptors are mainly found in veins and arteries. When dopamine binds to these receptors, it causes vasoconstriction. Dopamine is also known as Intropin and Dopastat. At low to moderate doses, dopamine's renal vasodilating effect is useful in improving renal perfusion with shock, thereby reducing the risk of renal injury. However, at higher doses, this effect is negated by the activation of alpha-1 receptors, leading to vasoconstriction. And at moderate doses, dopamine's positive inotropic and chronotropic effects are useful in treating heart failure, cardiogenic shock, and in some cases bradycardia. And at high doses, dopamine's vasoconstrictive effect is useful in treating severe hypotension, such as from septic shock. Adverse effects of dopamine can include arrhythmias such as tachycardia, chest pain or discomfort, and depending on the dose, hypertension or hypotension. Dopamine should not be used with tachyarrhythmias, and in most cases, hypovolemia should be corrected before starting this therapy. While on a continuous dopamine infusion, an individual is usually in a critical care setting where close monitoring can occur. This generally includes heart rate and rhythm using bedside telemetry, blood pressure, and urine output. In addition, monitoring of pulmonary capillary wedge pressure, cardiac index, and central venous pressure may also be necessary, depending on the indication. It is also important not to confuse dopamine with dobutamine. An arterial line is preferred over non-invasive blood pressure. Additionally, a central line is preferred over a peripheral. If a peripheral IV is being used, it is preferably in a large vein for short-term use and low doses. The peripheral IV should additionally be monitored for extravasation, or leakage of the medication into surrounding tissue, as it can cause tissue necrosis. If needed, extravasation is treated with phentolamine, an alpha blocker, which is injected around the site. I hope you found this video useful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!